You too, is a very forward-facing conclusion by conclusion remarks. You've heard a lot of conversation about DSRIP today. If I do something?
No,
okay.
I'll do it.
And Peggy Chan, who is ably, your agenda may say Greg Allen, and Greg is wonderful, and so is Peggy. Greg is in budget land this week, as many folks are, and Peggy, if you don't already know Peggy, Peggy's somebody that you need to get to know. She is important and plays a critical role in many of these forward-facing initiatives. Peggy was recently appointed Program Director for New York State's Delivery System Reform Incentive Payment Initiative, otherwise referred to as DSRIP. You heard about it today from many speakers. DSRIP is an investment of over almost $6.5 billion to transform Medicaid service delivery system to one that is, get ready, value-based and focused on outcomes, where have I heard that before, over the next 5 years. In that role, she's going to be leading a number of different efforts, and I'm sure her head has been spinning in the months that she's been at the department, working on and developing and providing support and direction to what has become 25 performing provider systems, or PPSs, that are poised to successfully implement a number of different projects that they've selected, and also all focused on reducing avoidable admissions by 25%, which is a pretty high bar. Peggy's worked in lots of different areas over the years on improving access and care for vulnerable populations. Her experience spans the continuum of care, which I think is particularly apt given the challenges of PPSs and what we're trying to do in terms of both alignment and integration. So experience in Medicaid managed care, managed long-term care, in both the public and the private space. Directly prior to coming to the Department of Health, Peggy worked at the New York Presbyterian Hospital, establishing the Office of Care Management for the Patient-Centered Medical Home, seems kind of apropos, and designed ambulatory care sites. Please join me in welcoming Peggy Chan.